Thank you, everyone, for tuning in to watch the Aspen City Council work session of June 23rd. The month is just flying by for all of us. And we're going to be talking about early childhood education goals and touching base on an item we had to drop at the last meeting because I was not available for the Housing Summit. And so we will jump right in, and I understand, Christine, you have a conflict.
I have a conflict. I'm on the board of the Early Learning Center, which receives funding from Kids First, so I will step out of the room.
Okay.
Thanks.
Thank you. And I suppose you can watch in another room if you like.
Yes.
Up to you. Thank you so much. And let's just go ahead and introduce yourselves, our presenters today, and we'll get going.
Great. I'm Megan Monahan, and this is Nancy Nichols. We're co-managers of Kids First. We're really grateful to share our work with you and for this chance, and maybe a little bit nervous too. There's a lot of content, so please forgive me. I will be reading a lot of my notes. So Kids First reflects Aspen's long-standing commitment to young children, families.
A little closer to the mics, a little louder.
Okay.
We've got this HVAC noise. It's hard to hear.
Okay.
Thank you very much.
Okay. Hi. We're really grateful for the opportunity to share our work with you today. Really grateful and also a little bit nervous. Kids First reflects Aspen's longstanding commitment to young children, families, and the child care providers that they serve. Our department is funded by a sales tax approved by voters in 1989, and it was renewed through 2040. The program generated approximately $4.2 million in 2024. High-quality early childhood education lays the foundation for all learning, for lifelong learning for children, for their social emotional development, and community equity. Kids First prioritizes customer service and continuous quality improvement. We use data and feedback to assess and refine our programming. We have a really unique program. Eagle County, Summit County, Estes Park, Routt County, and a couple of other places have taxes that are also dedicated to fund childcare. But Kids First is really a one-of-a-kind, holistic community approach to raising children. So this is the framework for our 2025 departmental compass goals. They reflect and are aligned with City Council values and the city values. They're built into the work that we'll be discussing with you today. If you wish to see more of our compass goals, we can get that information to you at a later date. I'm not going to go through every single goal that we have, but I will highlight a couple of items. So one highlight for our child care capacity goal is our community early childhood needs assessment. So this assessment includes a survey and collecting other data points to evaluate the need for future child care capacity. So that's from Aspen to Parachute. We will use this data and the report that it will create to guide our recommendations to council and concerning the expansion, like Burlingame Early Childhood Education Center. And then another highlight around workforce is a new project to support the early child care housing initiative. So it's in its infancy, but we really want to start the conversation about providing housing for early childhood educators. So this is our organizational chart.
1 second, you went back. What were the last two, just for a second? Sustainability and...
Okay.
Yeah.
Capacity, workforce, stewardship, and internal excellence.
Okay.
And the internal excellence piece is really revolves around continuous quality improvement.
Okay, thank you.
Yeah. Feel free to ask questions. We may say, hold off on that because we're going to get to it in a couple slides, but I want you to feel comfortable just asking questions. This is how our department is structured. Nancy and I co-manage, and we each have different and complementary skills. Nancy's the manager of operations. She handles all of the yellow brick building matters, financial and budgetary matters. She supervises the administrative specialist, the nurse consultant, maintenance tech, and program coordinator. And I'm the manager of programming, so that includes relationship building, the development and evaluation of our programs, and it's also the primary point of contact for City Council and the Kids First Advisory Board. This position supervises our coaches, our intern early childhood teacher, and our substitute teacher, as well as the mental health consultant. So that's our team. And we do describe a little bit about those different roles later in the presentation.
Okay.
So I'm going to just talk to you real quickly about our budget overview, which you can see on the screen. Basically, we divide this into 4 major work buckets: operational subsidies, financial aid, quality improvement, and reimbursable supports. You can see based on the colored dots which items go into which of these factors. But basically, we perceive these as our 4 areas of supports for the child care programs. Most of our funding, 84% of our funding, goes towards these 4 programs. We have 13% of overhead, and I will point out that on the chart, there's a place that says...
One second, let's get that microphone over to you. Thank you.
Okay. There's one that says no program in the purple dot, and that is this overhead piece. So if you're trying to match numbers, that's what the overhead is, and that's funding that we pay back to the general fund for things like IT support and the housing. But this is just a rough graph for you to look at. And again, we're going to go into all these areas and discuss them further for you to get a better understanding.
Okay.
So one of the main things that we really focus on is using this 3-legged stool as a really good visual for the work that we do. In order for childcare to be sustainable, we believe that you need to have affordability, availability, and quality. Underneath each of these, we list many of the items that fall under them. For example, under affordability, we have financial aid, emergency financial aid, summer funding, our infant toddler funding, grants to the programs, and the yellow brick building, the rent waiver, and all of the facility maintenance. Under quality, we focus on wage supplement, hiring bonuses. These are all things that are paid directly to the teachers. Coaching we provide for the teachers, mental health consultant, nurse consultant, and again, professional development grants. And then under availability, we have quality improvement grants again, infant toddler grants, Burlingame, startup funding, resource teachers, and wage supplement. So again, we just kind of use this to keep ourselves balanced. We know if any of these legs aren't balanced, for example, if we're not helping a child care program out in one area, we're not focusing on quality, but we're spending a lot of time working on affordability, we begin to see the program suffer. And so we try to refocus. We spend a lot of time reviewing our grants and making sure that they're meeting the needs of the programs by interviewing the providers and the teachers and families. So again, this is just a good representation of the work that we do, and we hope it's a good visual for everybody to carry forward as you think about childcare sustainability in Aspen.
So these are our 5 main areas of programming, and our whole presentation is really broken down into these 5 main areas. The information we present to you encapsulates all of our current work in these 5 main areas. The first area that we're going to explore is quality. In the world of early childhood education, continuous quality improvement is a mindset. It's really just how we operate in working with child care centers and within our own programs. The reason for this is that if we encourage and expect continuous quality improvement in the schools for the children, then we must be modeling the same mindset and those characteristics for the child care programs. So for all of our internal Kids First programs, like financial aid, coaching, all of those things, we evaluate and assess areas for improvement. Then we incorporate those in our quality improvement measures. This includes collecting feedback from evaluations, surveys, as well as just really listening to our partners. And this slide shows some of the programs we implement to focus on quality. Our coaches support teachers to learn essential skills to provide quality care for young children. This really includes evaluating classroom, their environment, and also the interactions, and then helping teachers support to increase quality in those areas. So, for example, if the coaches go in and do an observation in a classroom, and it seems like the interactions could be of a higher quality, then the coaches are going to focus on that with the teachers. Our mental health consultant provides social, emotional, and wellness supports to children, families, and teachers. And the nurse consultant provides required health-related supports. So this is like teaching CPR first aid to the teachers, medication delegation if a child needs a special medication, disease prevention, and then supporting the child care programs to comply with state and local immunization requirements. And then our quality improvement and professional development grants give child care programs funding to purchase materials for the classroom, and then also pay for college courses for training or trainings for teachers and directors.
So this slide is just a graphic picture of the funding that we provide all of the different schools that we work with. We work with 12 schools. And it's a good representation. You can see the names of the schools, the percentage of our funding to date, and the number of children that the schools provide services to. It is worth noting that it's not a completely even playing field. All of our grants are offered to all of the child care programs, but they don't all necessarily participate in those. A good example of that is the rent subsidy that we're offering to the Yellow Brick. So only the 3 programs in the Yellow Brick are benefiting from that, but it is funding that's given directly to the schools, so it is represented in the graph. One of the nice things about the graph is it's just a quick look to see proportionally how our funding is going. And the Early Learning Center, which is the large dark blue part of the graph, they receive 40% of our funding. They are the biggest program. They participate in all of our funding. And so they do receive the lion's share. And it's, again, it's just a quick visual. They should be having a larger piece of the pie. We can see another program up on the top, kind of in the maroon, Woody Creek Kids, serves about the same amount of children. However, they don't participate in most of our programs. They don't provide care for infants and toddlers. So we spend $500,000 on those funds to the programs that have infant and toddler programs because they lose money. And so Woody Creek Kids does not participate in that. So that's a reason why their pie piece is smaller. But it still helps us kind of maintain, when you see a visual like this, like, yeah, the money's being shared fairly and we can appreciate that who's getting what and why. We can talk more specifics about this, but we are going to talk about special programs further down and actual funding.
Yeah, Bill, you have a question on
Yes,
this?
please. Firstly, thanks for all the great work that you guys. Thanks, sorry about that. Firstly, thanks for all the great work you're doing. I think we're in a place right now where it's not a crisis level of childcare in our community, and you've made huge strides on that in the last 4 or 5 years, I think. So great work. I wanted to ask, could you talk a little bit about some of the schools that are outside of Aspen and significantly outside of Aspen that are on this chart, and the reasons why you and the board have agreed to fund them?
Yeah, historically, when Kids First funding was voted, it was for childcare. And there's never been funding available to childcare programs, for years. Our funding started in 1979, and it was very new then, and we were trying to figure out what to do. But most of the childcare programs are outside the city Aspen limits, and a lot of the children attend programs, a good percentage of them outside the city limits. So I don't know who made the ultimate decision. Rachel probably knows. She's got more history than I do. But so we've always funded all of the programs that are within Pickens County. We've always extended to Pickens County borders, including we used to fund a program in Redstone. But again, it was more about the equity of providing quality care to children in our valley so people could work. And so, again, we currently only have one program, and we'll talk about it later, the wage supplement, that is limited to childcare programs within the city limits. Everything else is funded to programs throughout Pickens County. Does that answer your question? I don't know who made the choice.
No, it's helpful to understand that. And my follow-up question would be, if you were given direction to limit it either to programs just within the city or very proximate to the city, would that give you incremental resources to do more things that you want to do or need to do?
I think it would give us a lot. It would give us a lot of resources. I think that the work we've done has shown that the need for quality care everywhere is important. We're seeing that at the state level, at the federal level. Everybody's really finally getting on board with the need for quality care. And I think, we can drill down in our funds, and it's dependent on what kind of new programs or where we want to spend our money. But I think our funding is allocated well. It would provide additional resources. I would feel badly about changing that. I think we've set precedents for a long time, and I think we've seen it be really successful.
Yeah, I understand that, and I can appreciate that notion, but we're here to represent the city of Aspen and the workforce of Aspen and the residents of Aspen. I understand that there's adjacencies,
Yeah.
but ultimately that's what we're here to do, right? So I have to first think of
Yeah.
are we doing it as best as we can, especially in light of this potential tax that's being contemplated
Yeah.
for sort of broader childcare in our valley, I think. I think it extends all the way through the valley. So that's why I'm asking that question. I just want to understand the sort of thinking, the history, and you've answered it, so thank you.
Yeah, I think it's a little harder to drill down on how many of these children, which are served outside of the proximity of town, are part of our workforce, when we know that, 65, 70% of our workforce does not live in city limits. And so I would see, you can always move the pieces around a little bit, but should we see some of these other ones close, or say, well, we're going to charge you a different rate because we're not getting the money we used to from Aspen, and you're an Aspen worker, does that mean we need to build the Burlingame Center sooner? Do we need to take that money and make sure we can house and provide another 150 kids that collectively these ones further away are doing? So that kind of starts to be the challenge. But it used to be there had some relationship to where the parents worked, and they would come up with some sort of my class of 50, we have 10% or 15% or something that goes to Aspen. And you can see from your chart, these are really pretty small percentages of the budget that we expend. But what percentage of the budget for those centers is it? Is it significant to the Stotts Mill?
No, I think again, as we were talking about this chart, like the Early Learning Center and Ajax Cubs and the school district, those are the three that are, would be within the city limits. And you can see they're serving the lion's share of the children, and they're also receiving the lion's share of the money. And again, when we're talking about this new tax coming, one of the things, it'll be a discussion we need to have, is we don't really know for sure how their money's going to be spent. And so
Right.
the biggest thing, and they won't know until it passes and they have a board that makes that decision. So you can't really have that discussion right now about that. We have talked to them, and one of our concerns is, how do we work with them so we're not duplicating funding?
Right.
Kind of like how we work with CCAP. Like CCAP picks up the low-income kids, and Kids First comes after that. And again, there's more slides about that. But there is going to be a really big discussion about what is the money going to be spent for if that tax passes, because a large portion of that is coming from Pickens County, but, is their intent to serve programs in a lot of areas, or is it going to be focused on one thing, like financial aid? So then do we, Bill, do we look at not doing financial aid for these ones that are in Pickens County? So some of our programs could adjust, and some of them could just be, yes, we only do financial aid within the city. The only other quick piece, and we can then move on, or I think John has a question, is the families that qualify for financial aid, they do have to live or work in the urban growth. So if somebody lives and works in Basalt, we are not paying financial aid for that family, or Snowmass, for that matter. So that is probably the only caveat that we really bring that back into the city.
One thing to take note of also, recently, we asked the child care directors to look at where do the children attending your schools live? And I think it was something like 87% live in Pickens County. So it's a high percentage of families, at least, that live in Pickens County that have their children in child care.
Thank you. John?
Well, and I can think of examples of, I have friends that live in Burlingame that their child goes to the Wildwood. I have another friend that lives in town that works in Snowmass, and so she drops her kid off at the Little Red Schoolhouse. So these are just examples of how, even though they're outside of the urban growth boundary, they're still being used by citizens of the city.
Yeah, that's a really
Yeah,
good point.
it's a very fungible project, and it changes with each family. Sometimes it changes with the second child. Now we're going to go here. Sometimes it changes when the house moves. So appreciate your really spending a little time on this graphic.
So now we're going to show you how Kids First funds support childcare affordability. These are just some of the programs that support schools to operate and remain open. Families qualify for financial aid on a quarterly basis, and it's based on their income. So each quarter, multiple families tell us that financial aid makes it possible for them to continue to live and work in the Valley. We also fund emergency financial aid. So this is for families who find themselves in an emergency situation. Usually this is something like one parent being hospitalized for a long period of time. Infant and toddler care. So infant and toddler care is not financially sustainable. There's no way for any school to stay open if they think they're going to run just on the tuition that they make from those families, because there are high costs due to the staffing requirements. The state really requires the low child-to-staff ratios. One director reported to us recently that without the infant and toddler grants, they wouldn't be able to serve infants at all. And some of them would probably have
Is
to
it
close.
one worker per 4 infants or something really low like that?
Yes, that's high quality. The state requires slightly lower, so
Okay.
I think it depends on the age too.
Age of the-
Yeah. So it can be 1 to 4, 1 to 5, but imagine
Tight
being,
ratio.
imagine being alone with 5 babies.
Yeah, conversely, in a preschool classroom, it's 1 to 12 or 15.
Right.
We also provide education and training for directors on business practices and the true cost of care. And then the yellow brick building waiver pilot, Nancy mentioned this earlier. In 2022, City Council voted to waive the rent for the child care providers in the yellow brick building. It was a pilot program, and this really lightens the financial burden for those schools. We recommend extending this program. Most of the other child care centers either don't pay rent or they have subsidized rent. For example, Aspen School District Cottage, they don't pay rent.
Right.
So we recommend extending that.
And now, what is making up for the saving for capital needs for the yellow brick? In the past, the rent, some would go to utilities, but some would go towards future needs for repair. Is Kids First backing that up as well?
Yeah, we still take care of the yellow brick, and we find that funding in our regular budget. We were able to kind of shift some things around and use some of our savings and things when we have capital improvements. So yes, and the providers do reimburse us for utilities, but the maintenance of the general building is
We're
all
picking up.
part of Kids First.
Okay. This would be a question more for Pete, but do we have Rob and the general capital asset team taking a long-term look at what the yellow brick would need for re-roofing or mechanical systems, and have that program somewhere too?
So Nancy can actually answer that question, but yes, we do long-term planning for the building.
Okay.
Yeah, and the asset department doesn't manage the yellow brick. We do, Kids
Yeah.
First does. And we've worked with them. Just last year, we had somebody come in and do a report on all the systems, checking the roofs, and we've been able to put that out on our capital plan
Oh, good.
for the future.
Thank you for that.
Uh-huh.
Please continue.
Okay, so on affordability, I'm going to dig a little bit deeper because I know people want to know more about how our financial aid program works. So I'm going to show you some slides about the cost of the financial aid program. We did some comparisons about Aspen to some other similar towns, Steamboat, Boulder. I have a slide on that. So we're just going to walk through here. And again, this might be an area where you'll have additional questions.
Okay.
But this first slide just kind of points out that there are other funding streams. So Kids First in the upper, we provide funding to 12 programs, and this is through financial aid. And we're currently serving over 50 children and 30 families. If you go over, CCAP is the state funding, and they serve children of low income. We currently have 43 children being served. Down below, you'll see we have 10 programs participating in UPP or UPK. This is the new state funding for 4-year-olds. It's only for 4-year-olds, and children are funded for 10 to 30 hours a week by the state, and we have 115 4-year-olds participating in that. And then we have 10 programs participating in UPP 3, and this is for the high-risk 3-year-olds. And they also get 10 to 30 hours of funding from the state, and we have 27 children participating in that. And so this is a good example of how we work together to make sure all the families are getting the funding that they need.
Now, before you move on that one, the county who administers the CCAP program receives those monies from the state, which they receive from the feds. Are we seeing any sort of cutback or projections on whether those dollars will continue?
So there's likely to be cutbacks, we're not sure. One of the good things about Pickens County, because we have Kids First financial aid and we're serving so many families, is that the CCAP funding has not ever been all used. As a matter of fact, the CCAP funding was not being used, so we worked with the county and the state, and we were able to raise the poverty level in Aspen to 300%, Whereas in Garfield County, it's at like 265, 270%. So we tried to reach out and get some more funds into more families' hands in Pickens County. But we have not overspent CCAP. Other counties, they have wait lists. And that's another focus of reasons why other people are trying to figure out how to fund financial aid.
Well, it's been a while since I was on the county, but I do recall that at times we would use all our CCAP money, and Nan Sundin would buy it from another
From other-
county that hadn't used it up. And I think I had read something about them being frozen in terms of new enrollees to CCAP programs because of the state cutback. So I was just kind of, we could just keep an eye on it and just watch where that's going, because that may or may not be something the feds are funding, unfortunately.
Yeah, and their fiscal year is July to July. So we're pretty good for a while, and our funding is not frozen. Eagle County's not frozen, and Garfield County, I think people are on a wait list, but it's not frozen.
Thank you.
We do meet regularly with Lindsay Maish and have those conversations, so I think
That's
if
great.
that's something that's coming down the pike, we will find out about it.
Thank you. Appreciate that.
So this is one of those example slides, and I understand it's hard to understand, so I'll try to explain it and kind of try to walk us through it. But, so you can see the annual median income, and this is based on the U.S. Census numbers from 2019 to 2023. And we also picked households led by 25 to 44-year-olds, thinking that those are usually the people with children. So you can see on the far left the annual median income. Then it's broken down to monthly. And then we did the average cost of preschool, because infant toddler care is hard to capture. So you can see this is the monthly cost in all these different areas, and you can see a pretty good comparison across the board of places that I chose to be kind of similar to Aspen. So Boulder, Vail, Steamboat, Highlands Ranch. And then the next category, so the U.S. Department of Health and Human Services defines childcare as affordable when the cost is no more than 7%. So what we did was take the percentage of the family's monthly income against the cost of care, and that's where we came up with the percentages. So you can see across the board, Aspen's percentages flush out pretty high at 23%. And as you go down through the towns, you can see that none of the towns are at 7%. Everything is more than 7%. And our financial aid, which I'll explain later, is based on 10%, not 7%, but that's the percentage that could be changed, and we'll talk about that. But then, so you can see what, in the next category, if everybody was at the 10% cost of care, you could see what those families' cost is. And if we were figuring at 7%, you can see what the family's cost is. So you can just kind of see in Aspen, if somebody's paying their full child care bill, it's about $1,900, which is 23% of their income. And then at 10%, which is where our financial aid is, where we say a family should afford 10%, is $827, and then the 7% is $579. So this is just kind of a good comparison of similar communities.
So are you saying that it takes about $1,100, almost $1,200 of subsidy to get the average Aspen family down to 10% of their
Yes.
care?
Yes, and I have a good example of how our financial aid programs to help families with that.
That's it.
I mean, yeah.
And the number on the left, the median income, is pre-tax, while the percent of incomes we're talking about, or the costs, are after tax,
Yes,
which I think is very notable.
it is very notable. We, in our financial aid program, do use gross income, and we'll talk about that too, but I will tell you, we've chosen to use gross income because it's too hard to figure out the cost. Then you don't have equitable numbers because I might be paying $4,000 a month for rent and you might be paying, $2,000, and then I might make more money, so I'm paying more taxes and you're paying less. So we tried to figure out the best way to balance that for families. So we weren't taking into account their expenses, which we consider are their choices, right? May or may not be, but they kind of are.
Do you know how many parents are out of the workforce due to the unaffordability of childcare, where at least one person's at home? That's not something that you keep.
That's something we've collected information on, but the child care needs assessment that we're currently running is collecting that kind of information. Like, in a survey, asking people, have you had to quit a job, or has someone in your household had to take time off of work because of lack of child care?
Or, I don't know, you can find out how many people have moved away when they've had a kid because of lack of childcare and other factors that make it unaffordable to live here.
Yeah, I mean, childcare and housing, we all know, I don't think there's anybody here that hasn't made a conscious choice to live here and know that the costs are hard, and that's why programs like Kids First and financial aid and the city housing have been designed, right? Because we all love to live here, but we all make those sacrifices too.
So, real quick, do you, the way you hand out financial aid, is it income bracket based or is it progressive? So like for every dollar more, you pay this much more, or?
I'm going to show you some examples.
I figured you would, okay.
And I think then you can ask me your questions and I'll do my best to answer them.
All right.
It's based on income.
Well, one more real quick is all the financial aid that you have, you give out every penny of it, right? There's none left in the coffers after
No.
on any given year, yeah.
No.
Thank you.
Okay.
All right, so this is what you're talking about.
Yeah.
There's a lot of factors to be involved, so I'll explain it as best as I can, as quickly as I can, and I'm sure you'll have some questions. But what we evaluate people's income based on their previous year's taxes, employment verification from their current employer. We look at paycheck stubs, and if people are self-employed, we ask for their profit and loss. We do take gross income, and we do take into account some factors. For example, if we see that a family's income from their taxes has changed dramatically, we have the conversation with the family to ask them why, or if they got a new job, or whatever. We try to take some consideration. We also try to kind of keep the playing field really level by most of the time we use their employment verification, which is I work 50 hours a week at $10 an hour, and we just figure that number. Both adults in the household have to be working to qualify for financial aid. You have to live or work in the urban growth. And if you work part-time, then you can qualify for part-time childcare, depending on how many hours you work. So this is a good example. We can look at the top family, 2 adults, 1 child, $154,000 a year, monthly income $12,900. We use the poverty level statistics that are published. So this family, based on their size, falls under 600% of poverty level. Depending on the family size, it moves them up and down the poverty level. We took the cost of care as $90 a day. So the first family's cost of care is $1,900 a month. We also rank them from poverty level. So if you're below 300%, you go to CCAP. If you're between 300 and 400%, we say that you can pay 10% for childcare. If you're between 400 and 500%, we say 15%. And at the higher levels, like 600, we believe that this family can pay 20% of their income. So the first example, this family wouldn't qualify because their cost is below that 20%. So if you go to the second one, it's this 2 adults. Now we have 2 children. We can see their poverty level ranking went down to 496%. Their cost of care doubled because they have
Two
two
kids.
children. We estimate that they can pay 15%, which is $1,500. And if you continue across, if they were at 10, it would be 12. So the way financial aid works, you can see that they can afford 12%. Kids First picks up the difference. So on this example, $2,349 a month we would pay for this family in financial aid. So they would stay at the 12% rate. The last column I just put in here to show you where it would be if it was that 7% number I talked about earlier. So if we were using 7%, then Kids First would increase their payment, and the family would still be out of pocket the same amount. So one of our continued requests for childcare programs is that they charge more. They charge the actual cost of care, because it's not going to increase out-of-pocket spending for a family who's receiving financial aid. Kids First is going to pick up that difference. So you can go on through all these different examples. You can go all the way to the bottom to a one adult, two child family, lower income. They're at 360% of poverty level. Their cost of care, you can see it's the same as that other family up there with two kids. But because of their poverty level, we only expect them to pay $680 of this, and Kids First is picking up the difference. So Kids First funding is available to a lot of families. The employment, live and work in Aspen keeps some families out of our program. Sharing financial information is hard for families, and we understand that, but there's just no other way to make sure it's equitable and that all families have a chance. Some of the middle income families, I mean, you can see the second example. Again, in my opinion, that family's making decent money, and they're still qualifying for financial aid. So, there's barriers. A lot of families with one child don't qualify. Once you start doubling and increasing that amount, you see a lot more families qualifying.
Yeah. I want to say that I appreciate that the schools are charging full cost, because that was always an issue before of how many people need early childhood education because they're going to go work, and how many want to use the program because they're going to go skiing, and that we're not subsidizing a recreational childcare experience for babysitting purposes. So that was a major move. Yeah, the facilities were not interested in telling people what the full cost was, but it is important they charge full cost. What's interesting to me to think about is you don't have the single parent or the two adults and somehow they're only still making $60,000 a year, or the single parent who is lucky to break 60. That would be a much.
So they're falling below the 300% of poverty level?
Right.
So those are the families going to CCAP.
Okay, so that's why they're just not there. And do you have any idea how many families would be in that range if CCAP funding went away?
Well, on this thing, we have 43 families using
43
CCAP funds.
Okay, that's helpful. Because CCAP's a kind of a tough program in some ways for the county to administer. Once somebody's in it, they can't say you're no longer eligible. It's like a 6-month run out no matter what. And even if the program's full, there's certain conditions under which you must take new people in.
Yeah.
And so it's a little challenging that way as they try to manage their dollars. And this might be a question you can answer later at a different point, but I'm wondering, for the different programs we run and the grants and training and assistance, how much of that is with people who stick with the program and remain a provider, and what is our retention after we've spent X amount of money helping someone really develop the skill sets and give them all the support in the childhood education?
Are you talking about staff?
Yeah.
We have some statistics
Okay,
about staff.
that'd be great. That'd be helpful.
Yeah.
Did other board members, Bill?
Yeah, I have an issue with something I just heard, Rachel, which is the characterization that someone who can afford childcare is just using it, or can afford the full price of childcare is just using it to go skiing. And I think it's important that they charge the full cost of childcare to those who can afford it, but that does not mean that they're using it recreationally or just to go
No.
skiing.
No, and
That's what I heard, and I don't like that characterization at all.
well, I appreciate the correction. I just perhaps had dealt with years when we were struggling with, are we subsidizing people who were making $400,000 a year as opposed to the people who weren't? Whether they needed or wanted the early childhood education be a different matter. But, you know, there was a point at which we were subsidizing everyone because we were subsidizing the daily rate down well below the actual cost.
Yeah, but
And so
but that's
again,
the
I
issue here.
apologize that
Thank you.
I'm, you know, perhaps characterized it wrong, but there was a challenge with, well, or is the help getting to the families that really need it?
Agree, but childcare is a need
For everybody.
irrespective of income. And
Yes.
again, you just said someone making $400,000 a year. You could make $400,000 a year in Aspen and not have unlimited financial flexibility to do whatever you want. Far from it. $400,000 a year doesn't go that far in Aspen. So we need to acknowledge and respect those with a broad array of incomes and not just cater to those with low incomes in Aspen.
Yeah, for sure. And
So
I
you would like
think,
to subsidize families making $400,000?
That's not what I said.
No, you said cater to, we must
Yes, we have
cater
to, the childcare programming, not the subsidy of childcare programming, but childcare programming needs to cater to our residents who also have high incomes.
Well, and it does. They just
That's my
pay
point.
the full
So
cost
I
as
just
others
don't
are
wanna-
subsidized.
I don't want to demonize those who earn more money or characterize them as trying to take advantage of this system. I don't see that. And in fact, in some ways, those that are paying full rates help subsidize the programs for those who cannot afford to pay full rates. So they're really benevolent towards the efforts of the program.
well,
So
and there's so many benefits.
I don't know, let's, if they're paying the full cost, how is that benevolent? They're just paying the full cost, and it's something they can afford out of their family budget.
well, we don't need to debate
Okay, but, yeah.
that point, but
no.
Well, and there's so many other reasons for childcare too, you know, like,
Socialization.
yeah, and learning and quality. And again,
Oh,
we
yeah.
talk about the quality of care and we talk about how it's changed, you know, in all the years, how, you know, the children are being educated and are all the brain development work that we're
Yeah.
working with in quality. So absolutely.
No, and I'm
Point well
sorry, if,
taken.
again, a mischaracterization, but we were at a point with this program, whether it was 10 years ago or longer, where all we did was subsidize down the cost of running the facility for everyone, and there wasn't individual family grants in the same way, and it just was a little out of balance. And so I appreciate that the balance has been restored.
likewise, thanks.
Thank you.
Yeah, and then, you know, the only other thing to say about this, and again, thinking about how there's a lot of partners helping families, you know, and remembering that Kids First isn't the only funder to help people and families, and asking other funders to step up to the plate, which we're beginning to see happen, is really nice. The cooperation and coordination between programs like us and the state and with the UPK kids, you know, it's nice to see that working across the board for all children.
Yeah, I think a question perhaps to ask, and whether it's answered now or at a next meeting, what would it take to get us down to 7%, the recommended average it should cost a family, as opposed to the 10%? What additional financial subsidies would be required to get us there?
And we have that.
Okay. I mean, maybe that's something to ask of the new child care partnership, of whoever our elected board member is going to be.
Yeah. Next slide. So this is just a quick wrap-up of the Kids First program. We have 30 families that qualified in May. We just had a deadline. 51 children being served. 17 of the families will receive financial aid for more than half of their cost of care. We had 9 families in the 300% of poverty level, 17 families in the 400% of poverty level, 3 families in the 500% of poverty level, and 1 family in the 600% of poverty level. So this just represents that we do have people in all of the different areas, and that families who apply and qualify are being well served.
One second, we have a question at the table.
I just wasn't doing the math in my head on the previous slide and just looking at this slide and just wanted to ask, I use the word punish, but I don't mean it this way, as far as just like, if a family makes more money, is it proportional that they'll end up paying more proportionally, where it's not like if you make $1 more, you're in this category now, and now your costs actually went up disproportionately from the raise that you just got at work?
Yeah, because of the poverty level division lines that we use, you have to have.
There's lines.
If you're in 399% of poverty level, we're expecting you to pay 10%, and if you're at 400, you're paying 15. So yes, I think you could say it might be disproportional to those people who are just really close to the dividing lines.
But the tuition is the same amount, but the amount that they're subsidized depends, on that level, the poverty level.
Where they fall.
Well, I think what she's saying is there's always a dividing line, whether you make it at 500% or 600% or 700%, but what...
It's just a value thing where I just think it always should be progressive, where you're not punished for making more money.
Right.
And that's just something that, like, this isn't housing categories, and even if it was, it's just something like, if you can just do it by percentage if you make a dollar more over this, because I don't think you should be punished for making 401% versus 399, because you're going to have a lot of people going to their boss being like, don't pay me as much, it's
Right.
not good for me.
Right.
I think whatever you do here should be set up where people can make more money and it's good for them, not disproportionately bad for them.
Yeah,
That's-
and I think our program is set up because we have all these different factors. We've always had it designed so that we can change those percentages or change the way the way we figure financial aid, the reason we do it this way, it's been vetted this way for 20 years and we've shifted it around. So by default, we have found success here. By listening to commentary like yours, we can see, there's a flaw here. How can we change it? And Kids First has always been open to changing it, and thinking through how can we serve the people better, because that's our goal, that's our mission, right? And then, again, back at this slide, in the last column, I put the 7%, if people only paid 7%, what the cost would be, what the Kids First contribution would be. And for Rachel's answer, if we moved all of these categories down 3%, it would cost Kids First roughly $20,000 a year to do that. So there's obviously room for moving all families to different percentiles if we think more families need to have financial aid, and if we want to spread out the poverty level, like if we want to extend the poverty level to 650 or 7, we can do that by changing the percentages and then looking at our budget and seeing the changes. 3%, if we moved everybody 3%, 3% of our budget, our current financial aid budget is about $20,000. So we could do that.
I'd like to look at a goal of trying to get it to be 7%. I realize it might not be immediate or over time, but, to Bill's point, people have higher mortgages and higher cost of living at different categories. Money's real tight on the low end as well, and if we can move from saying, childcare to the national standard, basically, that to be affordable, childcare should not be more than 7% of your budget. I realize that there's always competing values within the budget, so you have to bring that back and let us know what that does
Yep.
to
And
your
we can look
programs,
at
other
those
types
numbers.
of parts of the program. Bill?
Yeah, I'm generally along the same lines, some combination of what Sam and Rachel just said is I'd really like this to be linear, not step-based.
Okay. We can look at
I
those
defer
numbers.
to sort of the Kids First Board on where the ultimate percentage of income should be.
Okay.
But I think you should find your top set of, at what level of poverty or average area median income or whatever metric you decide to use. It sounds like you prefer poverty level for some reason. Establish your top set, and then everyone under that top set gets the same percentage.
Okay.
And it's on a dollar-for-dollar basis, like Sam suggested. I'd really much prefer to see it done that way.
Okay. And we're certainly open to that. We always have been and always will be looking at the adjustments and things that would work better. I have one last slide that I just want to show you, and this is pie in the sky. If we funded every family for childcare, we would have one family with one child. We would be funding about $1,900 a month, $23,000 a year. If we had a family with 2 children, it would conversely double. Where this becomes problematic, and for us to, again, this flows back into what you guys are talking about too, is that currently we have 340 available spaces in childcare programs, where we have 457 children being served. And that's because some families go 2 days, and some go 3 days, and some go 5 days. But let's say we're funding every family, and then every family would want their child to be in care 5 days, right? And so that would be an $8 million bump in Kids First, just to fund the 340 families. And so that would be problematic. I don't think we could do that. So I'm just painting a picture of where there's a balance and why we
And that
think
would be if
about
you're
these
paying
things.
100% of the full truck for their child.
Yeah.
So this is free early
Yeah.
childhood education.
Yeah, but the other problem is it takes away all those things, like all families would want 5 days. So then even if we built Burlingame, we would still not have enough childcare spaces. So somehow we need to think about, and I would love some more input and more thoughts about how we balance this. What other things do we think about? Like, do we fund families more or less based on the number of days of care they need? Or, because that's also part of the financial aid factor. And although it would be amazing to fund all children, I don't think the city of Aspen could afford to do that. But there's a whole bunch in the middle, right? Like, we have this program. Again, it's been vetted for 20 years. We've been working on it. Rachel's been aware of a lot of changes. I can talk a lot about the history. I've been at Kids First for 20 years. I haven't been in the financial aid program, part of it, for 20 years. But there's some history, and there are some reasons why poverty level was picked. I can't tell you what they are. I just believe in the system, right? I just trust that there were other conversations like this. But I just think it's interesting to look, because it would be great if there was free childcare, but it's just too big of a nugget right now. Maybe it's a dream. But let's talk about where the middle is. Let's talk about how more families and families that need help are being helped, and quality childcare continues. Any
Yeah.
other questions, thoughts?
Well, I would just say, I do think that the percentage of poverty level was chosen because it matches with the CCAP program that pays for the lower income students. And so that just became the ladder that we work off of. And everyone does percentage of poverty level because the federal government hasn't raised the poverty level in decades and decades and decades. I don't even think they want to come up with a new measure. So this percentage of is rampant throughout any number of types of programs that measure assistance. Bill?
The only thing I'd love some more information on in the future, and this is a long-term project, is understanding some demand projections for the future. And I know it's difficult. I know there's a lot of art to this, but, we've got these 2 potential sites for new facilities. I don't hear a lot about a lack of supply today. I did 4 or 5 years ago. I don't hear a lot about it today. We've talked about it as a council during our retreat. We talked that sort of the focus should shift to quality and sort of enhancement and improvement of what we have rather than creating new. But I'd like to know whether we should be planning for more capacity in the future at some point in time. I don't know if it's 10 years, 20 years, 50 years from now. But if we think that for some good reason, there's some data that supports this, that we are going to need one or both of those facilities, then we should be planning for those today. And so that's what I would propose tasking you with, is coming back to us with some kind of reasonable study. I know, again, it's a lot of art, because you don't know what the birth rate's going to be in the future, and you don't know what the inflow of population is going to be, et
We are
cetera.
conducting the community child care needs study right now.
Okay.
The report should be released in mid-August. I don't know that we didn't necessarily request of the consultants that it goes out, 50 or 100 years, but we did say, 5, 10, 15 years, looking at projections, because they know how to do that. They can look at, the school enrollment and different trends in population and birth rate. So that is something that we're hoping to be able to come back to you with.
That's great. That's most important to me, because I don't want to get back to like this crisis point that we
Yeah.
once had. So-
Well, and we ask them to make it replicable. So hopefully, we're going to get this study back that we're able to see what numbers they looked at, so we can do some predictions. We put out an RFP and ask a third party to do that, because those are not our skill sets. So it's due the end of August or September, and we hope to bring you that report, and they'll come and report out, and it will help us to understand, because we know that people are going to continue to have babies, right? And we also know what we just went through 3 or 4 years ago. Our predecessor advocated for this, and then we got behind the ball. And right now, we don't need it, but are we going to be behind the 8 ball again? And so hopefully this information will help us to predict that. And hopefully, again, it's another conversation of a balance. If we do decide that we don't need a new childcare today, how can we be prepared, and how can we plan for it to be built? And maybe there's some way to look at building a building that can be multi-use and be available as childcare needs, classrooms that can be shut off or opened up or whatever. So